take that letter with you, make a copy of that letter in the event that the med sub-carrier needs proof.
United Healthcare, they don't have a letter yet. United Healthcare is not getting their letters for a couple weeks. So if they don't have a letter yet, just need to let them know, once they get that letter, you have to have that letter to upload to your Medicare supplement carrier. I've already done one here last week, and they asked for the letter right away, so you gotta have that letter. If they don't have it yet, make sure that as soon as they get that in, they need to send you a copy. It's really important, so. All right, go back over again.
Over like the
Plan of, yeah.
Okay, so if you have a 2009, if they have a 2019 effective date on their Medicare card
Or before.
or before, they're eligible for Plan F underneath of guaranteed issue. If it is 2020 or after, they are guaranteed issue for Plan G. If you want to try to see if your client can get a Plan G based upon their health, you can do that. If they get denied, you can still go to a Plan F on a guaranteed issue.
I have a question.
Yes.
With that, is there a certain time? Can you write that before November, or is there a certain amount of days?
Their plan will be discontinuing at the end of this year, so it should be effective date of January 1.
Right, but isn't there something, you have to write it no more than 60 days before?
Yeah, but
It
they're
takes effect, or does
effective.
it not matter?
Their plan runs to the end of the year. So you're gonna have all the way into next year to write that. But yes, you go ahead and write that now, get it done for a 1/1 effective date.
Okay, so I can do that now. All right.
Yep.
You should be able to write them 90 days out.
Okay.
Okay.
Any other questions on that? Guys, I tried to make it very, very, very easy for you to understand. If you write a plan in red, you're not going to get paid. All right? I'm on the first page. Etna.
Say that one more time.
If the column is all in red, that means you're not going to get paid for that. If you write somebody
So in this
into that
case,
plan.
in this case, the middle plan, if you write that, you will make no money.
If you're colorblind, it still says non-commissionable with a county comp plan. I don't want to hear anybody say I wrote a plan and I'm not going to get paid on it. We went out of our way to make sure everybody can see that it's non-commissionable. They're constantly changing stuff. If they do, we will 100% let you know. We literally called Humana this morning to get some verification on different plans. As of right now, this is the best of our knowledge. The red plans are the ones you won't get paid on. Everything else, you're good to go.
I mean, everyone can kind of read. I mean, I'm not going to go through.
We're not gonna go through
of
line
these.
item on each one.
Can we go back to the SSBCI?
Yep.
Okay. So because there's so many carriers that are doing this, all of them, how do you report the SSBCI? I know devoted says verification through a form, but
Each one's gonna be different.
but
So if you can, if it has an HRA, like Matt said, do the HRA. A lot of the carriers are saying we're gonna use HRA, some are saying they're gonna look at medication, some not. As for that, I would do what's in your control right this second. And then worried about in January, because a lot of these people are gonna have to self-attest through the carrier. So I'm gonna tell them the same thing. If it's a food card they're getting, that does not automatically come to you. You're gonna have to show some type of chronic condition. And that's where you can go through the list. According to here, it says, okay, you had diabetes, that's a chronic condition on there, you should be able to. But after you get your cards in the mail for January, you're gonna need to talk to them and then self-attest that you have one of the chronic conditions.
so for
That's
all the
how-
carriers, just call in.
All the carriers, I'm gonna tell them the exact same thing. You have
When you
to
go back to see
self-attest.
them in January.
Yep. I tell them from the very beginning, because they're gonna forget the next time. So, remember I told you, you have to self-attest, which means you're gonna need to talk to the carrier. You're probably gonna be talking to them anyway once you get a card. So you wanna let them know, hey, I wanna make sure I can get my food card, and I'm gonna self-attest my chronic condition. If they need anything else at that point, they're gonna be doing that. But yeah, if you wanna put something back into their court and then have to talk to the carrier. Now, once you go back in January, and we'll talk about going back a little bit later, then you wanna make sure, hey, did you already get everything set up for your food card? And then you can kinda talk about it at that point. But yes, they have to self-attest.
Which carriers have bonuses for HRA?
It's in the book.
Is in the book?
Yep.
So, to go back to like page 5,
I think it's 3.
okay, you can put it.
Oh,
yes.
okay. Thank you.
It's right here where it says HRA bonus.
Okay.
Yep, the only two that are doing it on all plans are Devoted and Clover.
What if they have a chronic condition, but you don't put them on a skin plan? Maybe they could.
No.
So again, we're not gonna go through all the different things, but you can go through, pretty self-explanatory, this is Blue Cross Blue Shield, Blue,
Blue Cross is paying on all plans right now.
Blue Cross, Clover, and Devoted are paying on all plans and don't have any discontinued as of right now. If you've seen the pattern here, the smaller carriers and then Blue Cross have more of the PPOs and are paying on all the plans, and have more of the HRAs.
I will tell you guys this, that Clover 036 plan, it's got a $10 specialist copay and a $0 deductible on medications. That's pretty strong. Once again, I just want to mention with Devoted that dual plan is a C-SNP dual plan. That's gonna be the 006.
Which one?
The 006, Devoted, yes. It's in the top column, it calls it a C-SNP and then it says full dual on that. Remember, Devoted also expanded a little bit this year, guys. Allendale, Bamberg, Barnwell, Jasper, Horry, Williamsburg, Georgetown are some of the areas that they've expanded to that they have not been in years past.
Cigna, as you know, as you probably know by now, became HealthSpring. Again, it's still the same carrier, it's still Cigna and HealthSpring were together, just have a different name. If you had anybody before on the Cigna PPO, it did not get discontinued. It is still there. You cannot write anybody into that plan, but you'll still get paid your renewals on it. So some of those PPO plans were really, really good, really strong. They're just not available right now for 2026. The HMOs are the only things that are available for 2026. But if somebody's on the PPO, you can keep them there. It may be the best situation for them, especially because some of the out-of-pocket's pretty low on that plan.
The PPOs are not included in the book.
But they are not discontinued. Alright, we can go through there.
All right, guys.
Everybody, this is very important.
Yes.
Very
So-
important.
You're gonna see with Humana, there's gonna be a yellow auto move to a different plan, correct? Everybody see that, right? I tried to make sure that when that column came up, the column right next to it is the plan it's being moved to. Keep in mind, I don't know what it is about Sumter County. Sumter County is the only county that's not gonna get moved over to the new plan.
But you cannot write the new plan.
If you write,
No, you write the new plan.
no,
Not in Sumter
no.
County. We're in Sumter County right now.
Yeah, Sumter County. So you can't write the new plan in Sumter County.
And they're not being moved over.
Correct.
Then they're losing it. Oh, they're losing it.
No.
They're gonna be the only county that plan's staying.
Oh.
can't move them to the newer PPO, you will not get paid, and bad things can happen to you.
Well, it's not, the new plan's not in.
But, yeah, new plans are there, so that's
Yeah.
the old one.
Right. Put them in something else.
We also learned that if they're getting moved, you cannot write the new PPO if they're on an existing Humana plan at all. If they're on an HMO, any existing Humana plan, and you write the new PPO, you will not get paid.
So if you have people that are on this plan that's getting discontinued, you need to let them auto move. If you rewrite them, you will not get paid. You let them move them, you will get paid.
But not just that, if they're on any Humana plan, even the HMO that's not getting moved there, you cannot write them on the new PPO and get paid.
Anything that's gonna start with the H7617.
The only,
If they're in a Humana plan, it doesn't matter what Humana plan, and you try to put them in that, you're not gonna get paid.
the only people you're gonna wanna write that 7-6 plan for is from other carriers. Anybody else but Humana. If they have Humana, do not write that plan.
Is that confusing, or did everybody get it?
Well,
Both? So if they're in a current 3, 4, 5 plan, there's 3 of them that do this. If they're in that 3, 4, 5 plan, the 286 plan, the 347 plan, they are gonna get auto moved over to an H7617 dash whatever the next 3 codes are, depends on what plan they're in. They're gonna get auto moved over there. If you find somebody that's not your client and they're in the 345 plan, and you try to put them over into an H7617, you're gonna get in trouble, and you're also not gonna get paid. I don't think they're gonna terminate you, but let's not try. If you're on the Humana Gold Plus HMO ending in 169 and try to write somebody over in an H7617, you're also not gonna get paid. Don't put anybody in those H7617 that currently have a Humana plan.
Yeah, that new PPO plan is for anybody not with Humana.
That just came out this morning, or this weekend. Whatever.
When you pull it up, it's gonna say partially commissionable, that's the reason. Only write people in that plan that are not with Humana. So,
Yeah, Humana's got too many variables.
Correct.
Alright guys, I'm scrolling to the second to last Humana page. It'll say dual plans. Should only be 2 plans on it. Scott already said this, but we're gonna reiterate it. If you move somebody from the 277 over to the new Humana Dual HMO, you're gonna get full compensation on that.
so that means not renewal comp, but full comp like they're brand new to Medicare.
Like they've never been in had a Medicare plan before.
Whoa.
Brand new. If you move somebody from the DSNP PPO 277 Humana plan over to the new HMO 001 dual plan, you will receive full comp.
Hopefully, if you are doing that, every doctor that they see needs to be in network. Because the new dual plan, the HMO, is an HMO plan, it's integrated, but if they have a doctor that's not in the network, then they won't be able to see them. So the only reason you would do that from the PPO to the HMO is if they're seeing, like locally, all Roper doctors or all their doctors taking Humana in network, then that could be a really good plan for them. Because they get a lot more benefits when it comes to money, dental, there's a lot of good benefits that come with that.
They still do not renew their contract with MUSC?
Correct.
No.
I wouldn't look for them to get that anytime.
Roper, we'll see.
So there was an email that came out about Roper. We'll go ahead and address this. There was an email that came out. If you read through it, maybe you quickly read through it. South Carolina is not affected by that. I just want to clear that up. South Carolina,
Exactly that.
There's the bond secures,
yeah,
but not in South Carolina.
South Carolina's fine. The last page is going to be Humana's legacy plans. Basically, they're non-commissionable. We threw them in there so you can compare if people do have that.
Oh, that's very helpful.
And then there's United Healthcare. Essentially, United Healthcare really is there for their HMO and their chronic and dual plans. That is it.
I mean, they have decent plans. All right, guys. WellCare. United Healthcare is United Healthcare. Like Scott said, they're basically a C-SNP, D-SNP, HMO. WellCare's plans really, guys, are not that bad this year. They do have the lowest max out of pocket at $5,200. So if you got somebody that you know is going to hit that, I would probably look really hard at that WellCare plan.
Yeah, the two lowest ones are the simple open HBO and the simple open PPO. And WellCare does have some decent PPO plans that are available with pretty lower specialist copays than a lot of the other plans that are out there.
It used to be called the Mutual of Omaha PPO. Do you know which one that is?
That's the simple open PPO.
So there's two there. Or is two say simple?
Yeah,
Oh,
one's an
HMO,
HMO, one's a PPO.
Okay.
So if somebody was in that Mutual of Omaha,
They're-
are they automatically
They
migrated?
lost that designation middle of the year this year, so it's no longer Mutual of Omaha anyway.
So it's the same
So
plan,
they
there's
just
no,
stay
it's not a
on.
migration?
Nope.
Okay.
So, and like I said, WellCare only has one plan being discontinued. That was that dual plan that we mentioned before. Everything else is commissionable and not being discontinued.
So, see there's a deduction for tiers 2 and 5, is that right there?
So just to be clear, United Healthcare has no zero premium HMO plans that are commissionable. So all of our PPOs that are going away, if we put them in HMO, they only have a $45 premium option.
Yeah,
Yep. Because that was my go-to, is that the plan in the middle that's non-commissionable.
Don't write it into the red.
I mean,
But
that's
then,
just crazy.
what if they're already in it?
I mean, honestly, at that point, you're almost better off either with the Aetna HMO, the $22 one, or if you can look at Devoted or Clover.
Yeah.
At least they got PPOs, Devoted, Clover, or WellCare. Just depends on doctors at that point.
You see the deducted drug deductible?
I mean, Devoted has takes a lot of doctors. Again, you gotta remember on Devoted,
Okay.
if you have somebody that's seeing somebody that's not in the network,
Reading it right.
they do see doctors
You're
out of
reading it
network
right.
with the same copay as in network on most of their plans.
You may want to point that out, Shay.
What?
That tiers 2 deductible.
I am.
That's
I'll go
it.
through.
You gotta look at
I'll go
each
through
one.
those.
Every situation's different. If they're seeing a bunch of MUSC doctors, I wouldn't look at Devoted. Then I would look at something like Clover.
In Wardsboro, you've got what, about 4 or 5 doctors that everybody goes to see, and a lot of them did not want to work. That's why they said
Okay.
they wanted.
Well, if in that situation,
Devoted's not in Orangeburg?
No, I'm just saying, that- no, that's
Okay.
not what I'm saying. I'm saying there was just quite a few doctors that are in Burton, that were in Burton, who did not take them. And I was asking a question, did they kind of, open up and go in and more doctors?
I mean, they're always changing the network, so I can't really answer looking at and see, or?
They have added some more as they expanded. They had, to be able to expand, they had to have the doctors to do so. They went into the Barnwell, the Allendale, and so they're working their way, so you might find more doctors in network. Guys, I wanna go over a quick pharmacy thing. Go back to, Aetna. The prices for the prescription drugs with Aetna is for a preferred pharmacy. If it's a standard pharmacy, it's going to be higher than that. Did everybody understand that? The prices listed in the book are for preferred pharmacy only. If they have like a local pharmacy that's probably not going to be like a little mom and pop one, it's probably gonna be a standard, they're gonna pay a higher copay for those prescriptions.
But if you're using Medicare Center or, Integrity Connect, that should show you if it's standard or preferred. It'll change the prices on that. A lot of times it may even say out of network at that point and be higher price.
The other thing is, when you're looking at these, and obviously Integrity Connect, and I hope everybody uses that in every appointment because it's gonna clear up a lot of confusion for you. It's gonna give you the right information for your client's medications, doctors, all of that good stuff. Pay attention to the deductibles and what tiers deductibles come into. There are some, like with WellCare, that deductible starts on tier 2, which is typically a generic. But once again, Medicare Center is going to, Integrity Connect, whatever you want to call it, it's going to be able to sort through all of that for you. It should, when you go to do it, I know I've ran a couple, it's putting the total estimated cost, the lowest total estimated cost at the top. So when those plans populate, that top plan, as long as their doctors are in network and all of that good stuff, should be the cheapest plan for them that year.
So it's auto sorting that way, we don't have to click on total?
Mine was.
Because of you.
We can tell them which one has the.
Yes, mine was doing that.
Mine does that too.
Once again, I added the provider lookups. You know, Integrity Connect's great. It's not 100%.
No.
This is going to go directly to each carrier's provider lookup that you can scan with your phone, kind of look up that doctor if it's not showing in the Integrity Connect Medicare Center. So that's the book, guys. I just want to go over the GTL one more time. Guys, while you're doing this, first off, this book should never be shown to a client. It is for us just to simply go through, don't ever let the client see it. It's not allowed by CMS, right? It's just for our reference. The client picks a plan. You're getting set to go into the Medicare Center, move their max contact over. Scott's going to show you that here in a second. Go ahead and do a jack and scan that QR code, turn your phone around, let them watch that video for the GTL while you're inputting that data into their Medicare Center, into the Integrity Connect and applying for that. Once you get done with that, pair it up, run the quote, whether they're interested or not. Run the quote to cover all these higher co-pays inside these plans. Guys, these plans keep going every year. We went from $295 to $325 to $350. Now we're in the 400s with some of these hospitalization co-pays. It's a lot of money. That's more than most senior Social Security checks.
A lot of people out there don't have $2,000 sitting by their side when they go in the hospital. And then they come out and they're going to try to pay $50 a month, for the next 3 years to try to get it paid for. When you could simply added a hospital indemnity plan for $35 or $40 a month, that's going to cover them for these out-of-pocket expenses.
Present it, let them decide. Don't decide for your client. Brochures are right over here. We put a stack of them over there. John ordered a bunch more today. Put them in your stuff. Use them. That's going to keep you gas in your tanks and all of that during AEP. They're paying out really, really quick right now. Any questions with the book? show us how we can go into our max contact, pull that contact over into Integrity Connect, do electronic scope and enrollment.
Thank you again, Cheryl and Schaefer.
I'm just gonna spend just a couple of minutes. I mean, obviously, I think most of you know how to use Max. I don't know if you know how to put it over into the Integrity Connect. One of the most important things is you gotta make sure most of your data points are into Max. Number one is gonna be email address. You must have an email address in there or it won't go over to Integrity Connect. But when you're in your Max system, all you need to do is 3/4 of the way down, it says Integrity Connect. All you do is push that button. It's gonna take it and move it over into Integrity Connect, as long as you have all those pages there. Obviously, if you go back to it, that one worked. That one says it's success. It got moved over there. So you got that little green thing. If it says something red, because mine has before, that means you didn't have an email address, you didn't have something up to date. But that way, it'll automatically move over to Integrity Connect. Now it shows that, right there on the very top. You can go down here on Integrity. You can see some of the things that have been different, like right here today. You can see that I added some providers for Gregory. I also completed an incoming call that was recorded. So again, I had a couple appointments this morning. When they call through, when you make appointments and you send it to them, it called right through to your Integrity Connect. So you don't have to do anything to record it. It automatically records for you, which makes it very simple. If they're not calling you into you, because I never know which one they're gonna call in, I usually give them a couple minutes. They usually call in through that number. If they're not, then you can use the Integrity Connect app and then push call them. It'll call right to them, where again, it's automatically being recorded, it's stored for you, and you don't have to do anything else. As you can probably see, I've sent scope appointments out through there. It'll show all of your most things that you've done. Get down here, the other day, I shared some plans with Jeffrey Smith. So I'm gonna show you how to do that very simply. Integrity Connect is the better way to do scope appointments. It is the easiest scope appointment that's out there. All you do is send it either text it or email to your client. I'll show you how again. Also, to share plans, it looks the best when you're sharing it, for them to pull right up on the computer. You can physically share plans before a meeting, and then when you're talking to them, you're looking at the same thing they're looking at, and you can compare them over the phone. I'm doing about 65–70% of mine over the phone right now, because I just have too many of losing plans. But even if you're with somebody, you can still put them side by side and compare. So.
Hey Scott, not to interrupt you. Guys, if your client doesn't have an email address, because I know that's gonna come up, if you just go into the Max contact and at email do none at Gmail, it will allow it to move over to Integrity Connect. Because if there's not an email in that contact, it will not move over.
But if you are talking to somebody that did not have an email before, I mean, honestly, I know people are gonna say we don't have emails. 90% of people have an email. They really do. I've got clients, I've been doing this 18 years, that are just as old as your clients are, and they do have emails. It's 70s and 80-year-olds, no problem using email. But you can go ahead, then once it's moved over, you can add their email and share it with them. That way you can talk to them about it. Obviously, when you put on clients, that's where everybody's going to be. Your clients come up, we'll use me. You can type right into your client, and it comes up. Everything is on your Integrity Connect. You can update things that are your Medicare number. I don't have one of those. It shows on there. Yeah, here you go. It shows on there if you have scope appointments already signed, things that are updated. From what I was told, right now because of the government shutdown, they aren't able to add it. But as soon as the government gets back up and running, they have a feed that they're getting from CMS that's going to upload everything into here to show if your client has a special enrollment or their plan is ending. Right now, because of the government shutdown, they weren't able to add that over there. So I'm hopefully that'll be coming up very soon, so when you pull your client up, if that plan is ending, it'll say right there, the plan's ending. So, that's supposed to be up soon. Medical profile, this is where you can put your doctors, your prescriptions, the pharmacy. So when you go and you start a quote, when I'm just talking to this person right now, I can just push contact and scope appointment. And very simply, that's where you say send a new scope of appointment. You can text them, email them, even if they say, well, I wanted to go to a different email address. Great, new email. You can put it right in, the scope of appointment goes right to them. They can literally click, go down the bottom, click a box and push accept. You are now compliant to talk to them about the Medicare plans. So it's very, very simple to do. At that point, you can push start a quote. And it takes just about 30 seconds to a minute, it comes up, and you start seeing plans that you can compare. As you can see, Blue Cross is on that plan right there, but it's very simple. If you got a couple of plans that you wanted to compare, this is a new one.
Throughout last year, the United Healthcare C-SNP plan you couldn't do on Medicare Center.
Yeah, that's all been fixed.
That's fixed.
Yeah. But when you compare plans, you compare side by side. Again, we want to share these plans with the client. It shows right there where you can share them. As of right this second, some clients for some reason let me share it. I think it's the new ones, but if not, you could go right here and put the email address in. Oops, if I can type right. It shows the email verified. You could share it that simple. It's already been sent over to my email address. But now you can sit here and compare side by side. I will tell you it's a little tricky on the doctors. You want to make sure that if something shows up not in network, but you knew that it was before, you want to make sure on, I found this out the other day, you want to make sure on which location they're being seen at. Because it will change on location. So if it says like right there, I don't know where that is, but you can change your doctors right on there. It'll show like 4 or 5 different locations. Make sure it's in the right one. Then it'll show that it is correct in network.
So if they go to a location that is showing it's not in network, are they gonna have to pay out of network copays if they're going there?
What I was told is, you want to verify again on going, I always double check on the carrier's website to make sure that it's correct. And if so, then you should be fine. Most of the locations are, every once in a while, they'll have a location, like it said MUSC, I don't even know where that was in mine, it's Boulevard, so I don't even know. I know MUSC Hospital's not there. When you send something to your clients to compare, they're gonna get 2 different emails. You can see I got one with the view and compare plans, and one with the code.
Well, one of the English ones.
So they're gonna get it, all they gotta do is put that code in to compare. And then when you push view plans, it should ask for the code. They can just copy and paste it. And then they should be able to see the plans that I already sent to them. There we go. There's the 3 plans. Now, from this point, if they like the plans that you showed to them, they could actually enroll right from there. So if you have somebody that just wanted to see some plans, you could share it to them. They could enroll. It'll go right into your Medicare Center where you get credit for it. That's the cool thing about it. So I've got a lot of people out of state. That works really well. I can send them the plans. I don't have to be with them. They can enroll, and you get credit for that. But it's very, very simple to share these plans, so you can sit here and talk about it. They can see the same thing that you're seeing. So you're not looking at 2 different screens. You're actually going up and down together and going over the benefits. It makes it very easy. Or if you're in person, you can just put 2 or 3 together and say, here's a couple of plans I think will fit you best, and you can go over it together. So it makes it very simple. And then at the end, again, you wanna share it with them, you can. Or, let's say that you went ahead and you enroll somebody into a plan, and you wanna send that plan to them. Let me show you how to do that real quick too. Cause that's gonna be very important this year, cause most people aren't gonna have all the books, they're gonna be with you. So let's say we. Plans come up, I enrolled into this plan. Then you can share the summary benefits. Oops. Or everyone's covered whatever you want, right with that person right then. That's how quickly it is to share the summary of benefits. So now they've got it right in front of them. You've done your part, you've sent them a PDF of their full summary of benefits. Now they know what they've enrolled in. And that's gonna be really important this year, and I think going forward, because I think you're gonna see less paper going forward, less books. We're not ordering books anymore. I doubt you're ordering all these plans. There's too many of them, and they change too often. Then we find out that one plan we think is gonna be really big, but they don't write it all. And at the end of the year, John's gonna throw away the equivalent of 3 oak trees. So carriers aren't going up this year. This year, it's nice and easy to go ahead and share.
Does it track that for you?
If you share,
Yeah.
It
if-
shows that
if
you does, yeah.
If you send me, summary benefits, it will show up on there.
yep, so right now, I just shared that. So it should show back on my dashboard that I did share that.
It should track everything you do.
Everything you do is tracked on here. So when you go back, like I have shared some plans already in the last week with people, and then we talk a week later after we got the script of appointment. And I can go back and I don't remember what plans I shared with them at that point, but you can pull up exactly what was shared. So right there it shows plan was shared. Same thing if I shared 3 different plans.
Okay.
It's gonna show I shared 3 different plans. So yeah, you just pull it up. Let me see what I sent to them before. And it'll show you exactly what you shared with them. Especially if you're doing it a week later or 2 weeks later, or imagine that about a month later. And you wanna see.
Can I ask a quick question?
Yeah.
When it comes to the phone calls, I haven't done it before, because I know it's like, do you have to say something in particular with the phone call, as it's being recorded?
Well, whenever that's coming through, you can pull right up and it shows the disclaimer that you're supposed to say to them right when it comes up. So there's the 3 plans I already shared before, it pulls right back up. So yeah, so on your phone call, let's say, right there, when you push contact, it comes up, there's your call script.
Oh, okay.
So
You
you
do
can,
that first, then you get into the phone call.
Mhm.
No matter what the phone call's about, you always go to that. I mean, obviously Medicare.
Well, I mean, if you're gonna be, yeah, I mean, you're only using this really to compare plans or to talk about enrollment. But yes, and any of those that you're doing, you pull that call script right up. It just says, let you know that according to Medicare rules, here's what needs to be said. I wish we'd come quicker, but we're back here in this office, in the back.
Okay.
Yeah,
What's the phone number that shows up?
everybody has their own phone number. That's a good question. Let's pull this up right now. So, if you go to your little picture up in the very top right, this is important for a lot of different things, so I'm glad you brought that up. If you go there, you can go over to your account. See how quick it goes? Oh, that was quicker. So you go to your agent profile, it should show you all your information, your phone number, where it's being forwarded to, but there's the personalized business phone number that's forwarded to my cell phone. You can help set that up. This also shows you your link, so you can actually copy that link and send it to somebody. And they can go right into the plans, add their doctors, their medications, everything right into the plan. They can compare those plans without you there. They can only see the plans that you're licensed to sell. So, that way, if you wanted to just let somebody go and peruse, they can do that. You can copy that, and essentially, what it looks like is once they copy, and they go to it, that's what's gonna come right up. It's gonna show your picture, hopefully you have a picture on there, hopefully put that on there. all your information, that way they can call you right there, they can get synced, and everything's all right there for you, all already set up.
Is the information from Medicare Link and Medicare app going to transfer over, or do we have to re-input it in this?
I know a lot of the stuff automatically shows up there, I don't think it's being transferred over automatically, but I think a lot of it does come over there, cause I have a lot that's showing up. Now, the policies do mainly show up, so if you go back, to your dashboard. And I say, I pick somebody, I can go over to where it says policies in the middle. And it takes just a minute to usually show up, but it shows that she was in the Humana plan for the last 2 years, and there's a policy ID, it does pull all the information up.
Will it bring that up if you did not do the enrollment for them, or is that just?
No, that's
what
your
you're doing?
enrollments.
That's your enrollment.
So all of your enrollments should show up there. As for the doctors and medications, I know a lot of mine are showing up over there. I had not put it in, but you can just, put it from there over there. No, it does not automatically, you can go over there, but some of mine have. So I don't know exactly how, but they have. But if you start using this to kind of go through and use your scope of appointment, it's all gonna be going to one place. So next year, it should make it much easier when these plans start to go out again or something happens. Hopefully this is all linked up. I think it's gonna be here in the next week or so if the government stops the shutdown. Because they already had the feed, they said ready to come over. But
So everything that you've done and shown us today is all on the main page.
Integrity Connect, yes.
So you're no longer using Medicare Link at all?
I've used it sometimes for me to look quickly, because it's, I think, a little quicker to look at the plans just for me. But when I'm sharing it to somebody else, I'm using this
Okay.
every time.
Because when we all first started.
Because if you use the other ones.
Some use Link and some use app. So all my
Yeah, I know, but
clients
the
are
other
app.
ones don't look as good when you try to email to somebody. This actually shares side by side. And it's very simple to see. Or if you just wanted 2 plans, whatever, you're gonna be sharing it with them. And every time I've sent it to them to share and I talk to them on the phone, they have it pulled right up. It's pretty simple. Cause I've got people like, this person here is in Florida. I've got a lot out of town. If not, I mean, I'm gonna be talking just generalities, but you can't really see the plans. Alright. Any other questions?
This is the time to ask questions.
So now that we picked our plan, whatever it is there any way to quote it right from this to like a hospital or a cancer policy or anything? Is there any integration from this side? What's our next step with that?
Not right there. So again, while you put that in, the GTL does not come right up with that right there. But you can go to your dashboard, obviously go over and put your GTL. Or I don't use anybody else but GTL. I suggest that nobody should use anything else but GTL. I can tell you lots of reasons, but I do like GTLS. I automatically go to GTL's page, and I'm already quoting it while they're getting everything else together for me.
I use the app, if you guys are using an iPad, the app is getting added quicker, getting in there, moving
I mean,
quickly through it.
GTL makes it so easy now, and in order to get a signature, I did one in Florida today, all they do is send a pin to them, they give you the code, and there's your signature.
I am gonna bring this up because Amy did bring this up. Do not put your cell phone number in there to get that code. It has to be the client's.
Yeah, somebody got fired for that, don't do that.
That even though you're with them, it needs to be their phones.
What if we don't have a cell phone?
Then there's other ways to do the
Okay.
signature.
Okay.
Well, no, if you're with them and you're doing the GTL, they can use their finger to sign.
Oh, okay.
The only times you're really using that pin is if you're not with them.
Okay.
Because if not, why not use their finger and they sign and you're done together, you're good. And I don't know who doesn't have a cell phone now. I get you with the email address, but now with the cell phone?
Two biggest takeaways. Do not write any plan in red, right?
Right.
Post all your sales on GroupMe.
Guys, I also have GTL's cancer plan over here. I think it's a pretty good cancer plan. If you got somebody that's worried healthcare, hospital, cancer, whatever.
But do remember that if you're adding the cancer rider to the hospital indemnity plan, the cancer rider itself is not guaranteed issue. Just the hospital indemnity plan is guaranteed issue. You still have to answer the questions on the cancer plan.
And I know we brought this up before, but GTO is now up to 75 with guaranteed issues.
So I did have a couple of clients I saw this year, we did not do the hospital indemnity last year, and they're in their 73, 74. Hey, this could be your last chance to get guaranteed issue hospital coverage. You know, God forbid something happened, you wanna have that. I mean, I have hospital indemnity with my parents, and they paid for it, and you never know what's gonna happen. My mother was in a car accident a month after I got her hospital indemnity plan, and it paid for it. So I don't know why you would not have it with somebody unless they're on Medicaid, or unless they just say, you know what, I've got my $2,000 in the bank, not a problem, I'll pay for it if we're out of my pocket. That's the only two reasons to not have one. Alright. I think we're about